Andre Levinji has brought out a paper looking at dysfunctional states and peripheral nerve repair. So he specifically looks at the oxygen around us. And what he's saying is when nerves get injured, they have to repair themselves, but they might repair themselves physiologically in a functional way or in a pathophysiological way or abnormal way. And the crux of this entire review article is really just looking at states of oxygen around that nerve that's being healing. So he says when the oxygen levels are optimal, it's going to activate NADPH and the NOx pathway, and that will allow for proper angiogenesis, allowing the nerves to heal properly. Whereas there's low oxygen or abnormal or fluctuating levels of oxygen, or even a hyperoxia, which can be induced by hyperbaric oxygen therapy. So the crux of this entire paper is that more oxygen is good, more oxygen locally at that site is going to be good, and it can help these people who have their nerves heal and repair better.